As the United States was initially formed as an agrarian or farming society, a large percentage of Americans lived in rural communities. The scattering of individuals across a large continent required that the initial physicians travel to see customers. It is noteworthy to mention that the sheer distances in between communities at this time prevented large-scale outbreaks of communicable diseases. There simply wasn't much need to travel from community to community, unless you were a traveling physician, of course. We use the parentheses at this juncture in our lecture simply because these individuals were not licensed or certified in any official manner. Individuals who sold concoctions out of their handbags were eventually referred to as snake oil salesmen. It didn't take long for the citizens to realize that most of the formulas were nothing more than sugar water. Unfortunately, due to the unregulated environment in which these salesmen thrived, many of the concoctions sold were actually extremely harmful. In fact, many of these individuals were traveling the countryside selling morphine and heroin and calling them the cures of the century. Countless lives were unintentionally ruined as a result. It was so lacking in government oversight that many schools of medicine were simply mail-in based. By sending in 50 cents, various schools would provide medical booklets that were to be read, subsequently summarized, and returned. Once received, the school would then mail you a physician certification. Voila! Instant doctor. By definition, bartering is the act of exchanging goods or services for other goods or services without exchanging money. In early America, most people did not have hard currency simply because most individuals, including farming-based mercantile stores, used a bartering or trade-based system. This was true with early healthcare. The traveling physicians were not making large sums of money yet, and as such, they needed their basic needs met just like everyone else. These early physicians needed shelter, food, clothing, etc. They would trade their services for these goods. It wasn't until the Flexner Report that this inevitably changed. At the turn of the century, 1900, there were approximately 155 medical schools across the country. As was mentioned above, there were some schools that simply required 50 cents and a written summary, while there were indeed some, such as Harvard and Yale, that actually required several years' worth of education. Interestingly, it was not the federal government who was growing tired of quacks and snake salesmen. Rather, it was the Carnegie Foundation. The Carnegie Foundation sent Abraham Flexner and a team of investigators out to all 155 schools. The findings were published as the Flexner Report in 1910. It took over 10 years to compile all of the data. The Flexner Report had an immediate and lasting effect on healthcare delivery in the United States. After the report was published, medical education reform swept the country. More than half of the schools were closed or forced out of business by the United States government. Thousands of physician licenses were immediately revoked or suspended until such individuals could comply with new levels of regulation and oversight. Another consequence of this report was that had a more profound effect on the field of medicine was the simple idea of medical school cost. With the Industrial Revolution in full swing, the cities were burgeoning, many of them outright overcrowded. Disease and illness spread quickly, and the demand for medical practitioners increased dramatically. As a result of the Flexner Report, medical schools were now able to charge much larger sums of money for the coveted medical degree. Graduates of such programs now had little use of the bartering payment system. They could no longer accept such trades as they once did, as medical schools had little desire in receiving payments in kind. The medical schools demanded cash, and as such, the physicians did as well. As a result of the Flexner Report and the demand for money, medical costs soared. Physicians were now able to remain in place and set up practices as patients were willing to travel to them. There was a greater trust developing as a result of the increased schooling. Instead of being prescribed miscellaneous concoctions that more often than not did not work, people were actually getting better. Unfortunately, as mentioned prior, as tuition increased and physicians were incurring overhead, costs skyrocketed. People couldn't afford services rendered. Medical bankruptcies were extremely common. Some communities and some companies decided to pool the risk. In essence, everyone would pay a set fee every month into a community or company pool. When someone was ill and needed services, they could pay from the pool. Medical insurance, as we know it, was born.